Okay, good morning, everyone. My name is David Peyre-Costa. I'm a medical doctor, member of the Young WFPHA, and I'm happy to present today this session entitled Digital Citizenship for Health, Empowering Young People to Co-Create Tools and Innovate Solutions. This is part of the Global Public Health Week, organized by the World Federation of Public Health Association. And with me today, I'm very happy to introduce you to Whitney Gray, which is the Youth Engagement Coordinator or DTH Lab. We have also Katja Čič, which is a project associate of the National Institute of Public Health of Slovenia. And finally, last but not least, we have Berna Sert. She is a medical resident in Turkey, and she is also a member of the Young Sector branch of the World Federation of Public Health Association. Today, we'll talk digital health with the involvement of youth people, because the future of digital health can only go with the vision of youth people to co-create it, because the future of health can also only be digital in terms of efficiency and for the safe and the care of the patient. So we'll start with a brief introduction and presentation from Whitney Gray and from Whitney and Katja to talk about a session organized at the European Center of Budapest that we had a few months ago, talking about digital health, and we'll finalize our session with a presentation, recently published paper by Berna Sert, talking about AI and digital health. But let's go directly into the topic. I'm happy to present you to Whitney and Katja, who will open the session and talk about digital health and how they involve youth people on their daily practice. Over to you, Whitney and Katja.
Thank you so much, David. Happy to be here. Just to give a bit of an overview, I'll start with some background slides around the topic and what we've been working with Young WFPHA, it's the tongue twister, but say some of the work that we've been doing with them and YHO over the last year, and then I'll pass over to Katja, and then we'll kind of wrap it up together. So today, like David very eloquently introduced, is around the study session that we held with Budapest. It was around digital citizenship for health. And just to give everybody a little bit of a background story to how we got to the study session. When we were in the commission, so the Governing Health Futures Commission, we launched a youth statement, which was a very progressive statement. It was the first time in which a youth-authored document was a partnering document to the Lancet and Financial Times Commission report. It was completely youth-authored, and there were three main aspects that the young people had said at that time. It was a human rights-based approach to health, digital skills, education, and innovation, as well as a strong and inclusive health governance. In addition to the youth statement, like I mentioned, this was the partnering document to the Commission. And in this Commission on Governing Health Futures 2030, Growing Up in a Digital World, there were two key findings that the Commission had made in addition to what the youth statement was saying that young people want. And these two findings are really important to today's discussion because it's kind of the foundation in which we've now grown upon as DTH Lab. So the first is that enfranchised communities and public participation are crucial for citizens to co-design the future of health governance. And the second is the interconnections between health literacy, digital literacy, and the broader democratic and civic literacy skills are undeniable, arguing that none of these skill sets can be expressed effectively without the other in a digital age. And I think this point is actually really important to us as health professionals, especially in public health or in medicine, when we think about the digital transformation or digital health. And this is really pushing for something that goes beyond digital health. It goes to a larger framing of health, digital, and civic spaces all being very interconnected, interlinked, and the need to bring young people to engage in all three of those areas together. So we found that there's an existing gap within the digital transformation. This is that young people use digital technologies that shape their health and well-being, but they often lack skills, resources, opportunities to participate in governance structures or critically engage with digital ecosystems. And this again is really important to just summarize the first part of the work is that it was from young people themselves and from a commission, a global kind of expert-led commission. And this was one of the main problems that we decided as the DTH lab to take forward. And that's when we really started to focus on digital citizenship for health. And this is a frame in which we kind of pursue the thinking that equips young people with the necessary skills and capacity to influence governance solutions that increase health equity, enfranchise communities, and advance public participation. So somewhat the actioning arm of what the Commission and the Youth Statement have put forward. So our goal at DTH Lab, one of our main kind of core work plans is around digital citizenship for health. And for that, our ultimate goal is to kind of support a generation of empowered digital citizens for health who are able to participate and co-create policy solutions that improve their health and well-being in a digital age. So again, moving beyond the frame of digital health or digital literacy to a much larger frame of digital literacy, health literacy, and civic literacy within the governance and policy space. So some of the work that we've been doing over this last year in collaboration with YWFPHA and Youth Health Organization, YHO, was around the European Year of Digital Citizenship Education, which is from the Council of Europe. And within this kind of program of work, there were several different aspects that us as the lab took on and put forward. The first one that I really want to talk about is these online survey. This is something that we actually launched with WFPHA, Young World Federation, the youth part of it, last year. And the survey ran for several months. We actually launched it 1 year ago at the Global Public Health Conference. And we found that there were three of the biggest barriers to youth participation in the digital space. And this was one, inadequate information and knowledge about digital health and civic rights, inadequate information and knowledge of health issues, and inadequate digital literacy and skills. So summarizing that, it's really around the literacy, the capacity, and the skills needed to be able to participate in these spaces. The second thing that we looked at, which was really interesting with the survey, is what would increase the likelihood of using digital tools to support young people's health and well-being. So if their needs were met, including, you see kind of the top 5 responses. One is around confidence in personal data. Another is around better access to digital devices, faster or more efficient digital tools, more intuitive digital interfaces, and better digital literacy and skills. So again, a focus on literacy and knowledge, but kind of going a little bit broader than that to trust and privacy with your data, and then also access and infrastructure. The second area is around these intergenerational dialogues. And this is something that through the partnership with Young World Federation Public Health Association that we launched at this time last year, as well as YHO, we held several different intergenerational dialogues over the year. And one of the key findings from those discussions is that decision makers and young people agree they need to be better connected in supporting health policies for all. So these are perspectives from policymakers and from young people alike, whereas the survey really focused on young people. And then the last area, which I'll get ready to hand over to Katja, is around spaces for solution creation and innovation. This is one of the really core kind of fundamental areas of work at the DTH Lab, where we try our utmost to include young people from kind of conception to design, to creating research questions, to looking at the research, to helping in policy briefs. And this kind of really center of all of this is this co-creation aspect. So we want young people to be partners. We want to have their thoughts heard and their solutions, but also it goes beyond just this kind of tokenistic approach to young people and one-off events. So I wanted to share all of this backstory so you see that how we got to the study session was actually a year in work of research gathering and dialogues to kind of get us to a place that we could hear from young people to actually create a solution from those findings. So I will pass it over to you, Katja.
Thanks, Whitney, and hi also from my side. So we'll also present the event that took place in February of this year, which was a collaboration between all three organizations that Whitney already mentioned, but also under the umbrella of Council of Europe with their European Youth Center in Budapest. So we set out to do this about a year ago when Whitney and I sat down and started writing the application for a study session on digital citizenship for health. And we really wanted to make sure that it included the priorities that all of the organizations truthfully believed in, and that's to empower young people, but then also to provide a space and a platform where new solutions can be co-created by the participants. So if you move to the next slide, just to give you a bit of an insight as to what does it mean to actually host a study session. So our final aim turned out to be a bit more complex than what I just mentioned. So we still went with the aim of empowering the participants, but we also added that we wanted them to be engaged and active citizens. So really putting a lot of focus on the civic literacy aspect of things, in line with the 2025 being the Year of Digital Citizenship Education here in Europe. And to provide them with the necessary skills and knowledge in order to actually enable them to advocate for policies that are also grounded in human rights-based approach. Now, why human rights-based approach? This is also because the Council of Europe and one of their main priority areas is also human rights besides democracy. So we really wanted to kind of also push that angle in order to make sure that the young people are also informed about, you know, different perspectives through which they can advocate for digital citizenship for health that is not necessarily coming just from the digital or the health sector. So if we move on to the next slide, just to put a couple of numbers in front of you, the study session actually lasted for 5 days, and we had 18 different sessions, altogether attended by 30 participants, including the trainers team. And we kind of had 4 key pillars in terms of ensuring that there were adequate team building sessions so that the participants would be able to get to know each other, get connected, and obviously cooperate well. Then we had a huge chunk of knowledge sharing sessions because we wanted them to start out on a similar, you know, basis when it comes to level, when it comes to knowledge. And then we kind of upgraded that with skill development and co-creation sessions, which then led to the final outputs that I will touch upon a little bit later. So if we go to the next slide, we have a little video prepared just so that you can see about our experience. Well, I hope you enjoyed that. Those were just a couple of highlights from our 5 days in Budapest. And I'm sure many of you are wondering how this whole workshop went, because you probably saw that we chose to use a lot of non-formal education methods, including different interactive tools. You saw people lying down, working in small working groups, chasing each other around, and so on. And that is because the purpose of the study session is also to kind of explore this non-formal setting and kind of provide education on a certain topic in a different way. And that is kind of the motto of the European Youth Centers. They also provide you with an educational advisor that is in-house that helps you develop study sessions. So if any of you ever wish to do something like this on your own, you will have a lot of support coming from the Council of Europe. But from our side, we were lucky to have trainers that were already quite well versed in this aspect. So we really tried our best to kind of push this co-creation with young people in order to make sure that each session provided them with a space where they're not just beneficiaries, but they're actually partners, and their input was engaging, it was meaningful, and it built towards the final outcomes. So in terms of what we wanted to achieve is, again, we wanted to create a space to ideate and a space to create. And this led us to a couple of outcomes, which were kind of pushed into two different streams. So we had our participants separated into two groups when it came to co-creation spaces. One group was the drafting group working on a statement on digital citizenship for health. The statement is currently still under the final stages of development. So at the end of the study session, we had a rough draft. It was kind of like a design of the direction in which we want to go with. So the participants provided a brief summary of the gaps and barriers. They agreed on what were the priority areas that need to be addressed in the statement. And then they also started working on a very strong call to action. I will let Whitney explain later on what are the next steps when it comes to the statement. And then the second stream was creating a platform pitch. And that is because DTH Lab has this ongoing task of creating a digital platform or web page where young people could engage on the topic of digital transformations for health, and also provide them with an opportunity and a platform where they can participate in civic spaces, governance structures, advocacy, and so on. So the larger team that was doing the platform pitch was actually then divided into two groups further on, which each delivered their own kind of iteration of what this platform could potentially look like. And DTH Lab is now taking their ideas forward for the final development of the platform. So it was not just an exercise for the sake of the study session itself, but it is actually something that will be used in the future for current and then also future youth. And this enabled us to really make sure that the solution is youth-centered, that it's guided by policy and evidence, and that it's also relevant to the current needs and wants of young people. So if you move on to the next slide. As I mentioned, we had a couple of outputs delivered throughout the study session. So the first one was the youth statement, and you can see the wonderful drafting group here on the picture. The two groups that worked on the platform pitches, and then we also provided the participants with several opportunities where they could engage in technical working groups on different topics connected to digital citizenship for health, digital literacy, health literacy, and kind of relevant related topics. So a lot of this work kind of built together to this final momentum that we are currently still rolling with and working in the future. So I think I will kind of say goodbye with the last slide, which is that we are very proud to say that all of the participants have actually agreed that digital citizenship for health is super relevant to young people, but they do want more knowledge and skills in order to actually meaningfully engage in digital health and civic spaces. But to say goodbye, here is our last photo from the study session. You can see a lot of smiling faces, so I do think that our evaluation was indeed correct when it said that people were quite satisfied with the workshop. Back over to you, Whitney.
Thanks so much, Katja. I actually was perusing some of the attendees, and I know several of the participants from the study session have joined us today, so welcome back. I'm really happy to see you here. I think one thing that's quite important, is just as kind of a general comment, is that Katja and I wanted to share a lot of the kind of methods and the way that we think about youth engagement for this particular panel, because it is quite innovative in a way of thinking through how young people are involved from the beginning, how they're actually creating the solutions, and then also how there's continuity from one event to the next, carried through by working groups, by key outputs. And that's something that I think is a really great lesson to be shared, not only as kind of the findings from a study session that we all hope, will multiply and reach other young people and different policymakers, but also that kind of core foundational, thinking as young people, as partners. So I think that's one of the key points to our discussion as well. So the findings particularly kind of allude to some of this. So one key finding from the study session is that youth want access to interdisciplinary education, literacy, and professional skills. And these three areas are actually very different from each other, as kind of portrayed by the participants in the group, and that they want these types of education and skills within all three areas of digital health and civic spaces, that we kind of must push beyond this digital health literacy framing and kind of go into all three of these different spaces. The second is that young people want to be partners with active participation in shaping health policies, digital spaces, and advocating for them. The third is that it's lonely growing up in a digital world. I think it's lonely in general, even if you're in the physical reality. So youth really want to be part of something. They want to build communities together. They want to include young people from all geographies and disciplines and diversities, and even those who are hard to reach, to really bring them together, to connect with each other, and to make solutions that are inclusive of everyone's needs in a community. This one was actually really, it was really provoking for me to be in a space with the same people for 5 days. And for the trainers team, like Katja and David and myself, we were there actually like 7 days together. So there is so much to be said about being in the same presence of each other. And although funding is difficult to acquire, I really think this is something, when you're building youth engagement strategies and the way that you're going to connect with young people, we find it time and time again that there are so much better qualitative findings from in-person physical spaces than you can get in virtual places. And the fourth one is around AI. And as AI advances, youth are convinced it should never replace the power of human connection, our ability to empathize with one another, and our shared values in this kind of physical world. So those are the key findings from the study session. Also, just to kind of wrap up some of the findings from the survey and the intergenerational dialogues. And that's really moving us forward to the next phase of the work. So I wanted to share with you the Digital Citizenship for Health Policy Brief. There's a small little QR code in case you're interested in learning about some of the technical aspects of digital citizenship for health. What are some key actions that stakeholders can take? I think it's a really great read. It's not super exhaustive. It's just a few pages. So happy reading afterwards. The other kind of pin to the group is to join the My Health Futures network. The opportunity to join the study session, besides direct kind of offers to the partners and their networks, we shared the call for applications exclusively on the My Health Futures network. So we do this quite frequently, actually, for different events and different opportunities, including writing, research opportunities, etc. So if you're not there yet, please join so that we can stay connected afterwards. It's a very short form with just a few demographics so that we kind of start to build an understanding of who's in the network. And of course, if you want to follow us or be a part of the movement, happy to have you. But just to say thank you for listening to us. Hopefully you got more from just kind of key findings, although those are interesting, and hopefully you got some data about what young people are saying, and also more recently shared reports. But yeah, youth engagement as a concept, I hope, is the take-away message from today. Thanks so much, David.
Thank you. Thank you so much, Whitney and Katja, for this very, I think, passionate presentation of what happened in Budapest. It personally, as a trainer, reminded me very good memories, and I was personally impressed that how much people coming from various countries, various cultures, various backgrounds, we all worked during 1 week on the main topic, and everyone came with its own ideas to create and propose new solutions to involve youth in the field of digital health. So personally, I think it was very, very productive and inspiring. So thank you for leading this great event. I also want to thank the participants, the attendees. We are almost 50 people here, which is great. Thank you so much. I hope everyone enjoy the presentation of this webinar. Now it's time for a few Q&A session for Whitney and Katja. In the meantime, I have one for you, Whitney. In your opinion, what challenge do you think young people face in becoming active in digital citizens, particularly in the health space?
Yeah, thanks, David. I actually think that's a multi-response required. One thing that I definitely see with all of the young people that we've engaged with, particularly in the medical kind of field, is that we oftentimes, because of education and the way life is and how we have to kind of deliver, we get tied up in a very narrow way of thinking about a concept, or in turn the concept, and to get to a solution. So I think that's one kind of core issue that I would say in getting to digital citizenship for health, is that it takes this larger frame or this different way of thinking about what's needed that goes beyond just health in a healthcare setting, but is actually around health in your everyday life. And to have good health and well-being in your everyday life, you need to have different capacities and different skills in different areas than just in the healthcare setting and in medicine. So I think that's one really great and cool thing about webinars like this, and especially who you attract to join these sessions, is that we need to continually to broaden our kind of scope of disciplines and geographies that we have in these discussions, so that we can kind of get to a place with digital citizenship for health where it's not just the health workforce, or it's not just public health students, but it's kind of all young people in all their different diversities, because to me, that's the solution that we want to have. We want a diversified kind of way of thinking to get to a solution that's the most inclusive, that's grounded in kind of this equity and human rights-based approach. So that was a bit, like I said in the beginning, a bit of a long-winded response, but to me, that's something that's really important if we're aiming to get to where we want to go.
Yeah, I think it was very, very good and concrete answer actually to a broad question. Thank you, Whitney. I have another question for you this time, Katja. I know you're involved in the WHO Youth Council, also in addition to your daily work. So how do you see the role of youth-led organization evolving in digital health governance?
Well, I mean, I'm sure everyone has heard it at least once, but youth are indeed considered to be the digital natives. it comes much easier for us to kind of adapt to the new changes in the digital world. So why shouldn't we be also involved in co-creating the spaces, the environments, the policies that go together with that, especially because we are the generation that spends the most time on these tools, spends a lot of time online, whether it's for work, whether it's for life, because currently it's very hard to study, to work, to even go through life without kind of stumbling upon some sort of aspect of the digital world. So it is very much important that youth organizations are involved because, first of all, being organized as youth provides you with bigger strength. It provides you with a platform. And as soon as you get organized, you're also able to build on your recognition. So you can still be an advocate in your own individual right, but in order to actually achieve something through the system, such as the UN or WHO, even Council of Europe, a lot of them require for you to have a backing organization because unfortunately the systems are still, in that weird mix of rigidity versus more modern types of structures. And these youth organizations can actually help you elevate the voice and bring you to the platforms when you can then advocate for what you believe in terms of needs and wants. Because what we figured out, even during the study session in itself, that the 30 participants that were there, while they had certain points where they were all aligned and connected, but there were also a lot of differences between different countries, between different kind of communities and subcultures in terms of how they are involved in the digital spaces. And this all needs to be reflected in the current policies. Unfortunately, it is not yet. But youth are indeed pushing for, for digital health, digital transformations for health, digital citizenship for health, however you want to call it, to actually be put higher on the agenda. Because while it does have a lot of positives, it also has a lot of negative effects that need to be managed either through regulation or supportive services. In order to make sure that we are able to, actively and healthily live besides the digital world that is actually kind of a part of modern day life already. So maybe I'll leave it here, but youth organizations are crucial for the work that has been happening here.
Thank you. Katja, one last question for both of you with a short answer before we go to Berna's presentation. In your opinion, what are the biggest obstacles to integrating digital health innovation into public health systems?
Maybe I can start and Whitney can wrap up, but I actually just about a half a year ago, I went from a youth non-governmental organization to a National Institute of Public Health here in Slovenia. So I think I can speak from firsthand experience about the differences that are there, because it is very much different between like how the uptake of such technologies and what you can do with them and how you can use them goes in a youth organization or even just general in civil society versus the approach that, national institutions are taking when it comes to this. The progress, unfortunately, when you are in some sort of like governance-focused institute or a research-focused institute, goes way slower than we would anticipate, because obviously science needs to double and triple and quadruple check before it is sure that something is, a policy or a practice that is worth implementing. So that means that all of the changes that are, going to happen will happen with a bit of a delay. Well, with the youth organizations and civil society, you can actually already see them trying out different approaches. So they are kind of like beta testing the different policies way ahead of time. And I do think that what we need to see here is a bit of a better connection between both of these entities in order to make sure that the changes that are needed, because digital space is here, whether we like it or not. And it's just going to get bigger, especially with the AI in health and how it can be used in order to advance public health or, other health matters in the health systems. So there needs to be more collaboration there. But yeah, I don't want to go into like the different kind of applications of the digital tools and AI in public health, because there are so many. But I will just say this kind of need for like having more research, but also a lot more implementation of different testing of practices and policies in order to make sure that we know what we are talking about, because this is still a very much evolving space.
Thank you, Katja. Whitney, would you like to add something?
Yeah, happy to jump in here, because I think it's important, at least from the standpoint of DTH Lab. So digital citizenship for health is one of our kind of 4 main core projects. And I just want to say them quickly because I think it might be interesting to other people. One area really looks at digital determinants of health, and this is kind of to Katja's latest point in her intervention, as well as my point earlier around that health is taking place in everyday life, which is based on the thinking from the Ottawa Charter in 1986. So if you haven't read that, I really suggest you to read it, even though it's 40 years ago. It's extremely relevant to today's discussions around how the digital world is kind of affecting our health and well-being, particularly young people. And the other area of work is around digital first health systems. And this is really focused on kind of to your core question here, David, around how digital innovations are kind of, affecting the public health systems, or what are some of the challenges. And with that work, we've had consultations at the global level and at the regional level. And there's like this shared understanding of values that need to exist for these innovations to be kind of picked up and implemented in a correct way, according to young people. There's also kind of health priority areas that these digital innovations should try to target, which I think is also interesting, because oftentimes platforms just come out or solutions come out, but they're not actually driven by what people are saying they should be designed to tackle. And the third area that I think is quite interesting is around this balance and these tensions that arise from when you have innovations and upscaling, what that can do indirectly in a sense. So there's this tension that young people have pulled out, and we're getting ready to launch this report in June, which will have a lot more of these findings that you can look at. But there's this really clear tension between affordability and data privacy, because oftentimes to make things more affordable, you share your data and then maybe you lose that kind of trust and privacy. Another one is around accessibility and innovation, which is really interesting. So young people want things to be accessible, but then that also comes at a cost for possibly decreased innovation, because that's a kind of a tension in itself. There's also this really cool tension around existing platforms or existing tools and new ones, and that we need to kind of find this strike of a balance between using things that work well and improving them compared to creating something new. And I think the last one that gets to Katja's last point is around this online and offline kind of thinking and this digital determinants of health. And if you remember from the slides of the findings, this was actually one of the core kind of findings from the study session as well, is that young people are lonely. And so I think it's important when we're thinking about digital innovations and solutions in digital first health systems, in the public health setting, et cetera, that they really are cognizant of what young people particularly want, and the solutions that they hope are kind of created with them to get to that point that they want to see. So thanks, David, and thanks, Katja.
Thank you so much for this clear answer on a not easy question, actually. So now, presentation on this study session in Budapest is over. Thank you again, Whitney and Katja, for your precious insight and valuable contribution. Before we go to the last part that Berna will present, I will just be happy to share with you a few information on the World Congress of Public Health, organized by the World Federation of Public Health Association that will be held in September 2026 in Cape Town, talking about health without borders, equity, inclusion, and sustainability. We will share the inscription and all information in the chat if you are interested. So now it's time for the final part from Berna Sert. She's medical resident in Turkey and she's member of the Young WFPHA Working Group of Digital Health. And I think you have recently published a paper on impact of digital health intervention on health literacy, a systematic review with qualitative appraisal. So I'm very curious to see the method, the results, and you have your presentation now. Thank you, Berna. Over to you.
And hello, and again, for our participants, welcome. And this is, as David said, this is our work as Young WFPHA Digital Health Working Group. This is our first work together, a systematic review, and the title is Digital Health Interventions Impact on Health Literacy, systematic review with quality appraisal. Our team is, as you can see, multinational. We have researchers from 6 different countries, and this is very much good gain for us to approach this topic from different perspectives. My presentation plan is like this, and we will go with our background. As you see, as you know, health literacy has emerged as a pivotal factor in personal and public health outcomes, especially in this age, in the digital age where the information is abundant. And a variety of digital interventions have been employed to improve health literacy, and their results are very promising in behavior change and disease management. And with this potential, a detailed investigation into the digital health interventions scope and effectiveness, and this investigation was essential. We have 2 definitions here, a digital health definition and health literacy definition. Digital health is defined by WHO as the field of knowledge and practice associated with developing and using digital technologies to improve health, and the health literacy is the degree to which people have the ability to find, understand, use information and services to inform health-related decisions and actions for themselves and others. So our objective in this systematic review was to examine digital health technologies designed to enhance health literacy and explore their effectiveness. So as this is a systematic review, we used Peyre-Costa. We included studies with any population, any technological intervention in digital health, any outcomes related to health literacy, and articles between 2013 and 2024. It's an 11-year period. For data selection, we used 3 databases. As you know, PubMed is really health-oriented database, but we also use 2 other databases, IEEE and ACM. The engineers use these databases mostly, and we have these formulas of keywords to use. And in the article screening, our inclusion criteria were Peyre-Costa, and we included almost all kinds of study designs, including original research or surveys or qualitative and quantitative studies and reviews. Because we are a multinational group, we could screen the studies in English, French, German, and Italian. And the exclusion criteria were any literacies other than health, the digital interventions that are not included in the WHO definition of digital health, and gray area interventions were assessed in the extraction phase. We did this screening in a double-blinded way, and for the data extraction, we used the framework from WHO's classification of digital interventions, services, and applications. As you may know, this framework was deemed as the most accurate to date for classifying interventions in our review, and we needed additional categories, health equity components, misinformation components, etc. And these are the data that we extracted from the studies. We distributed the manuscripts among us, among other authors, and our team lead has conducted a second review for the uncertainties, and we also used quality assessment. The Oxford Levels of Evidence tool was adopted for this work, and in this rating, the level 1 is about systematic reviews and meta-analysis, where the level 5 is opinion of respected authorities. We assessed the studies according to this. And in the results, we managed to reach to 1,029 studies from these 3 databases. And after that title and abstract screening, we had 124 articles eligible for full text screening. And in the end, after excluding the duplicates and media literacy studies or non-health related outcomes, we had 39 articles eligible for our reviews, manuscript preparation. And included studies, these 39 studies, were mostly interventional studies, and we categorized them into types of digital interventions. We saw that most of them were websites and online platforms designed for specific groups like adolescents and vulnerable groups and older people, cancer patients, etc. And mobile apps were also in the studies, and multimedia tools and telehealth services. 7 studies were about conference proceedings that they did not have full text, and 7 review studies. Our main findings are that theory-driven interventions yield consistently positive outcomes. We know that cognitive theories are very much used in studies of health behavior. And in these studies, we see that self-determination theory and theory of planned behavior were used generally, but we also know that there are other cognitive theories also. User-centered design is foundational for effective DHIs. Designs to fit specific user needs, especially young adults have different needs. Vulnerable groups have different needs, and chronic patients, and designs should answer these users' needs. And we also found that conversational and simplified app designs help with people with low literacy levels, low health literacy or low digital literacy. These simplified designs help them very much. And cultural competence is essential for successful DHIs. We found in the studies that minorities have this digital divide problem, and if these people can find the applications, interventions designed for themselves, they stay engaged more. And language barrier is an important problem in countries like United States, where different languages are spoken, and tailoring these interventions to cultural needs are really essential. And active engagement studies are used and also are crucial for sustained adherence. And we know gamification strategies work, and also some social engagement strategies like discussion boards work for people, especially for young adults. Sustainability of health literacy gains is crucial because you do the intervention, you see the results, but the results can fade away with time. So follow-ups and ongoing support are important, and reinforcement strategies, reminders, or these kind of improvements are needed. And accessibility and digital equity are essential for broad reach of these interventions. Adequate digital access is very important. We again see socioeconomical barriers and device usage skills in older people. Older people overestimate they may overestimate their device usage skills, but some interventions are needed for improving these skills, so they're not vulnerable in this digital age. The limitations were limited variety on intervention types. We saw that many interventions were focused on websites and online platforms, but we know that in this digital age there are many opportunities, many digital opportunities, and they can be used. And we saw that most of the studies, almost half of them, were from North America, so it raises the question of different geographic areas, how will they approach these interventions? Will they work in different cultures? And underrepresentation and digital inequity is especially in socioeconomical and age groups, these gain very much importance. And in our study, because we had wide range of studies, in the evidence quality, we had variability, and targeted interventions. When you create and design an intervention for some specific groups, you get the results, but you cannot generalize these results to other groups, maybe. And we also saw that there were inconsistencies in outcome evaluation. There are some evaluation methods. There are some scales to evaluate the results of these interventions, but again, in some of the studies, there was a lack of standardized evaluation. So this is a need. We need to have a method that can be used in different interventions, and we can talk the same language that way. So the conclusion is that digital interventions do improve health literacy of people. And our key messages are that well-designed digital health interventions enhance health literacy, but digital divide limits access, especially for vulnerable groups. Long-term success requires support, user focus, and cultural relevance. Thank you for joining us.
Thank you very much, Berna. Thank you for this presentation and the work on this paper. So I see that there is no question in the audience. So I may have one for you. So based on the finding from your review, what's the state of digital health literacy globally at the moment?
As I mentioned, we have this problem of evaluating the situation and the results of interventions. So some studies use e-heals, some studies use different scales. So we cannot see the level of literacy of populations right now. And there's also this fact that digital health has been evaluating in the last years, and before the digital health, we had e-health, and before that we had technologies in healthcare services. And because these digital services evaluate with time, there are some new innovations and new skills that people need to learn and use. And there is not just I cannot say this percentage of people are very much skilled in digital health. This is another limitation in the literature.
Okay, thank you, Berna. Thank you very much. So I think there is no more question in the audience. So unless there are some questions from the panelists or any remarks that comes out, I think we can gently wrap up this session. So it's been a nice 1 hour journey with all of you. I hope all the attendees, you had some nice insights. As I said, because I teach mostly to medical students in my practice, in addition to my practice, and I think it's always useful to attend this webinar, this training session, because then you plant the seed of one knowledge that you will make grow all along the weeks, the month, the year that comes after, and then this reflection that has matured, you can share them with someone else. And this is also how little by little things progress and work.